Ankylosing spondylitis, AS, is a chronic, inflammatory disease that primarily affects the spine and the sacroiliac joints, where the spine meets the pelvis, though it can also involve other joints in the body. AS is part of a group of diseases called spondyloarthritis, which also includes psoriatic arthritis, reactive arthritis, and arthritis associated with inflammatory bowel disease. AS is known for its progressive nature, and if left untreated, it can lead to the fusion of the spine, causing significant stiffness and limited mobility. Causes and risk factors. The exact cause of ankylosing spondylitis is not entirely understood, but it is believed to have a genetic basis. The primary genetic marker associated with AS is the HLA-B27 gene. It is important to note that not everyone who carries this gene will develop AS, but the presence of HLA-B27 increases the likelihood of developing the condition. However, other factors such as environmental triggers, example infections, may play a role in the disease's onset in genetically predisposed individuals. Family history is another significant risk factor for AS. People with a close relative who has ankylosing spondylitis are at an increased risk of developing the disease. Most individuals diagnosed with AS are between the ages of 20 and 40, though it can occur at any age. Men are more likely to develop AS than women, and the disease tends to be more severe in men. Symptoms. The symptoms of ankylosing spondylitis can vary widely from person to person, but the most common and characteristic symptoms include chronic back pain and stiffness. One of the hallmark symptoms of AS is persistent pain and stiffness in the lower back and hips. This pain is usually worse in the morning or after periods of inactivity, and it improves with movement or exercise. Over time, the pain can become more pronounced and can even affect the upper back and neck. Inflammation of the joints. Although AS primarily affects the spine, it can also cause inflammation in other joints, such as the shoulders, knees, and hips. Inflammation in the sacroiliac joints can cause pain in the lower back and buttocks. Fatigue. Many individuals with AS experience significant fatigue, which can be debilitating. This symptom is often linked to the inflammation present in the body. Limited flexibility. Over time, AS can lead to the fusion of vertebrae in the spine, resulting in a loss of flexibility and a hunched posture, also known as bamboo spine. This makes it difficult to fully straighten the back. Enthesitis, inflammation of the sites where tendons and ligaments attach to bones, known as entheses, is another common symptom. This can affect areas such as the heels, knees, or elbows, leading to pain and swelling. Extra-articular symptoms. AS can also cause symptoms outside of the joints, such as inflammation in the eyes, known as uveitis or iritis, leading to redness, pain, and sensitivity to light. Some people with AS also develop aortic valve disease or other heart issues. Diagnosis. Diagnosing ankylosing spondylitis can be challenging, especially in the early stages when symptoms may be mild or nonspecific. A healthcare provider will begin by conducting a thorough physical exam and reviewing the patient's medical history, including family history of AS or other autoimmune diseases. Blood tests to check for the presence of the HLA-B27 gene and inflammatory markers like C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, are often performed to aid in diagnosis. Imaging techniques such as X-rays or MRI are crucial in confirming the diagnosis and monitoring the progression of the disease. X-rays may show signs of joint damage or spinal changes, while an MRI can detect earlier signs of inflammation in the joints. Treatment. While there is no cure for ankylosing spondylitis, treatment focuses on relieving symptoms, reducing inflammation, and improving function and quality of life. Treatment strategies may include medications, nonsteroidal anti-inflammatory drugs, NSAIDs. These are commonly used to reduce pain and inflammation. Disease-modifying antirheumatic drugs, DMARDs. In cases where NSAIDs are not effective, medications like sulfasalazine or methotrexate may be used to slow disease progression. Biologic drugs, tumor necrosis factor, TNF, inhibitors and interleukin-17, IL-17, inhibitors are biologic medications that target specific proteins involved in the inflammatory process. These are often used when traditional treatments are not effective. Physical therapy and exercise, regular physical activity and stretching exercises are crucial in managing AS. A physical therapist can guide patients through exercises that improve posture, flexibility, and strengthen muscles around the affected joints. Surgical intervention, in rare cases where joint damage is severe, surgery may be needed. This may include joint replacement or corrective surgery for spinal deformities. Prognosis. The progression of ankylosing spondylitis varies from person to person. While some individuals experience only mild symptoms, others may develop severe spinal deformities or experience significant disability. Early diagnosis and treatment are essential in managing the disease and preventing complications. With appropriate management, many people with AS can lead active and fulfilling lives. However, untreated AS can lead to permanent damage and disability. Thus, ongoing medical care, a tailored treatment plan, and regular monitoring are critical to managing ankylosing spondylitis effectively. Conclusion. Ankylosing spondylitis is a chronic inflammatory condition that primarily affects the spine and can significantly impact a person's quality of life. While the exact cause remains unclear, genetic factors, particularly the presence of HLA-B27, play a major role in its development. Early detection, regular monitoring, and appropriate treatments can help manage symptoms and reduce the long-term effects of the disease. Through a combination of medications, physical therapy, and lifestyle adjustments, individuals with AS can improve their overall function and live relatively healthy lives.
Thank you for watching. Please subscribe our channel.